My name's Lisa Tostanoski, and I'm an inventor in the Lemelson-MIT Student Prize Competition. Multiple sclerosis is an autoimmune disease that affects 2.3 million people worldwide, in which cells of our immune system incorrectly recognize and attack myelin, which insulates and protects our neurons. Current clinical therapies for MS inhibit all immune function rather than targeting myelin-specific cells. These approaches have provided important benefits for patients, but are not curative, require patients to receive frequent lifelong injections, and are nonspecific, which can leave patients susceptible to infection. And so a question in the field is whether we might be able to generate more specific control of the disease rather than blocking all immune cell function. The inspiration behind our approach is that the cells that drive disease in MS primarily develop in specialized immune tissues like the lymph node. And we can think of the lymph nodes like a classroom environment in which cells that recognize myelin learn to mature and become inflammatory, then travel out of the lymph node to the brain where they attack myelin. The goal of my project is to use bioengineering to reprogram this learning environment, instead teaching cells to protect myelin while leaving the rest of the immune system intact. To access this learning environment, we use a direct injection technique, and we deliver the signals encapsulated in a particle. And together this allows us to control the local doses of the therapy over time as the carrier degrades in the lymph node. So to test the therapeutic potential of this approach, we used a mouse model of MS. And so this is a typical mouse that's been induced with the disease. So she's alert and able to move around her cage, but her tail and hind limbs are completely paralyzed. And we gave a single dose of the tolerogenic particles in the lymph node. And this is the same mouse 2 weeks later. We've reversed paralysis and restored hind limb function. The ultimate goal is to reprogram lymph nodes in human patients, where the potential to control disease with minimal side effects could be transformative.
Lisa's work is a perfect example of bringing together clinicians and engineers to develop innovative technologies that might enhance the specificity of therapies for autoimmune diseases. Her work may even have a translational impact and really affect and improve patient care.